Hello there, how are you? I hope you are in fine cheers and in great health. Diabetes, or commonly known as blood sugar, is becoming very common these days. At least 1 out of 10 persons is affected by diabetes. This has become so common because of the sedentary and stressful lifestyle. Today, we will gain an in-depth knowledge of what is diabetes, how you can prevent it, and what steps should be followed to deal with it. Diabetes is the condition in which the body doesn't properly process food for use as energy. It is a defect in the body's ability to convert glucose into energy. Glucose is the main source of fuel for our body. When food is digested, it changes into fat, protein, and carbohydrates. Foods that affect blood sugars are called carbohydrates. These, when digested, changes into glucose. Glucose is then transferred to the blood and is used by the cells for energy. In order for the glucose to be transferred from the blood into the cells, the hormone insulin is needed. This hormone is released by an organ that lies near the stomach. This organ is known as pancreas. When one has diabetes, his body either doesn't make enough insulin or can't use its insulin as well as it should. This causes sugars to build up in the blood. That is why diabetes is often referred as sugar. We have two situations of sugar. The first one is hypoglycemia. It involves an abnormally diminished content of glucose in the blood. The term literally means low blood sugar. Its symptoms are sweating, trembling, dizziness, mood changes, hunger, headaches, blurred vision, extreme tiredness and paleness. The second one is hyperglycemia. It is a condition in which an excessive amount of glucose circulates in the blood plasma. The term means high blood sugar. Its symptoms are dry mouth, extreme thirst, frequent urge to urinate, drowsiness, frequent bedwetting, stomach pain. There are mainly 3 types of diabetes. Type 1 diabetes, also known as insulin-dependent diabetes or juvenile onset diabetes, accounts for 5 to 10% of all diagnosed cases of diabetes. Type 2 diabetes, also known as adult onset diabetes or non-insulin dependent diabetes, accounts for about 90 to 95% of all diagnosed cases of diabetes. Gestational diabetes develops in 2 to 5% of all pregnancies but usually disappears when a pregnancy is over. Women who had gestational diabetes are at increased risk for later developing type 2 diabetes. Let us understand these types in more detail and their causes. In type 1 diabetes, the body cannot make insulin. It occurs more often in children and in young adults. People with type 1 diabetes must inject insulin to control their blood sugar. This is an autoimmune reaction because the body is attacking itself. There is no specific cause, but following triggers may be involved: viral or bacterial infection, chemical toxins within food, any component causing autoimmune reaction. Any genetic disposition may also cause type 1 diabetes. In type 2 diabetes, the body can make some insulin, but not enough, or the insulin the body makes doesn't work right. It often starts in adults. The causes of type 2 diabetes are obesity, living a sedentary lifestyle, increasing age, bad diet. It is controlled by balancing when and how much you eat with how active you are. Gestational diabetes is a type of diabetes that occurs only during pregnancy. The stomach converts food into glucose and then it enters mother's bloodstream. The mother's pancreas produces sufficient insulin, but the insulin is resistant. Glucose can't get into the body's cells, causing high glucose levels in the mother's bloodstream. This enters the baby through the placenta. This brings extra glucose to the baby and causes the baby to put extra weight. There are a variety of causes of gestational diabetes. Some of them are family history of gestational diabetes, overweight or obese, suffering from polycystic ovary syndrome, having large baby weighing over 9 pounds. The diagnosis of diabetes is made by a simple blood test measuring your blood glucose level. A blood sample is taken. Blood is put on the monitor to check the glucose levels. If glucose level is too high, insulin is administered. Usually, these tests are repeated on subsequent days to confirm the diagnosis. The test is administered on fasting, 2 hours after the intake of food, and also randomly. The normal values and the diabetic values are on your screen. In allopathy, there is no cure for either types of diabetes, though there are many ways of keeping diabetes under control. Diabetic treatments are designed to help the body to control the sugar levels in the blood. Type 1 diabetes require insulin. Injected insulin replaces the insulin missing in the body. You will have to learn how to balance your insulin with your food intake and your physical activity. Type 2 diabetes will vary dependent on your blood sugar level. Patients are advised to change their lifestyle and lose weight. An exercise program is advised to be followed. Oral medications are prescribed. In severe cases, one may need to start insulin. If you are diagnosed with diabetes, begin to make lifestyle changes. Decrease portion size. Make healthy food choices. Limit intake of concentrated sweets. Increase fiber intake. Test your blood sugar regularly. Maintain a healthy weight. Increase your physical activity. Educate yourself about diabetes. Keep a track record of your blood sugar level. At PCTC, we follow ancient and natural means to bring the sugar level in control. When one follows the treatment prescribed by PCTC, he can surely lead a normal lifestyle. Marma in Sanskrit means secret or hidden. Marmas are certain vital areas of body. A marma point is a juncture on the body where two or more types of tissues meet. By stimulating these points, internal organs corresponding to these are also stimulated. Color therapy involves the use of colors for healing. It is a vibrational healing technique. The frequency which lacks inside the body is increased and the disease is cured. Acupressure is the treatment by applying pressure on specific acupoints that lie along the meridians or the channels in your body. By stimulating specific points on these meridians, toxins are flushed out and person is relieved from the ailment. Number therapy is a technique by which certain numbers increase vibrations inside the body. This brings down the symptoms in a very few days. Lastly, we have some home remedies which are sure to bring down the sugar level and put it back under control. We present to you some self-care tips to prevent diabetes. Get involved in more physical activity. As far as possible, take plenty of fibers in your food. Whole grains may reduce your risk of diabetes and help you maintain the sugar level. Lose the extra fat over your body. Make healthier food choices. Eat low carbohydrate diets. Control your portions. Follow a healthy eating plan. I hope that you got enough information on what is diabetes and how you can prevent it. For more details, you can log on to healthforall.wix.com/pctc, or you can email us your problems and queries to write to pctc@gmail.com. You can also follow us on Facebook at Panacea Cosmic, or you can contact us on the numbers on your screen. Thanks for watching. Enjoy a healthy weekend. Bye bye.